Okay, so let's get started here. And Dr. Klempner, please take it away.
Okay, thank you, Lon. Hello and welcome, everyone. For those of you that don't know me, my name is Leon Klempner. I am a retired, proud board-certified orthodontist. I was in private practice for 38 years before retiring from clinical practice. I'm currently the director and the craniofacial orthodontist for Mount Sinai Hospitals here in New York. I'm part-time faculty in the Department of Orthodontics at Harvard University, and I am the CEO of People in Practice Marketing, as well as the co-host of the Golden Age of Orthodontists monthly podcast. But most importantly, like everyone else here, I'm someone who cares deeply about the future of our profession. This learning service series aims to explore important topics to our specialty. And today's, as Lon mentioned, today's webinar is part of our advanced educational track, which is sponsored by Dental Monitoring. Very pleased today to have Dr. Mark Vaughan from the University of Pacific Orthodontic Program join me today to discuss his experiences integrating dental monitoring into the UOP graduate residency program. Our goal is to provide an in-depth look at dental monitoring's role in educating the next generation of orthodontists. We hope to provide academic leaders, faculty, orthodontic residents, and program directors with valuable insights as to how technology can benefit and enhance the educational process. Welcome, Dr. Vaughan.
Thank you, Dr. Klempner. It's very nice to be invited, and I'm looking forward to our webinar this morning.
Okay, well, let's get right to it. So, I mean, historically, for me at least, when I think of dental monitoring, I think about a remote monitoring tool that was very useful during COVID, for example. However, as I reflect back now as an educator, in my experience, it's also a teaching tool. Evaluate a resident's critical thinking skills, for example. So, can you describe exactly where you see the benefits of integrating principles of remote monitoring into your program from the patient's perspective, from the resident's perspective, and lastly, from the faculty and from the institution?
Yes, certainly. I think firstly, taking patients. I think in this day and age, patients love technology. They all have phones. They seem to be glued to their phones and tend to be very much involved in getting involved in their surrounding environment. And so I think dental monitoring fits very nicely into the mindset of patients these days, the so-called sort of the gamification sort of phenomenon. I think patients like to feel more engaged in their treatment, and they like to be included, but they need to be seen less frequently. They want to be involved in their treatment, but to be seen less frequently. I think they are reassured by the fact that their treatment is being monitored, and it's nice and reassuring to them that if anything is going wrong, things can be picked up quickly rather than from appointment to appointment. It aids engagement of the patient and the parent's interest in the treatment and the ongoing care of the patient. Remote monitoring, as it says, it's clearly for sort of monitoring from a remote aspect, and people tend to think of it as being utilized from a distance, whereas remote monitoring can be used for people around the corner in terms of an educational tool in seeing how their treatment is going week upon week, something that we haven't really had compared to from appointment to appointment. So I think it really has revolutionized our ability to interact with our patients. And the whole object, as you quite kindly said in your introduction, the aim is always to enhance our overall treatment experience for our patients, our treatment outcomes, and obviously we've always, as an orthodontist, got an eye to the length of orthodontic treatment. So if we can quicken that up, I think that's always an advantage. In terms of residents, clearly residents are very involved in technology generally these days. And I think it's very important that they don't feel left behind in many respects of it. So I think residents in our program really appreciate the exposure to new technological innovations in both a learning and in a clinical practice environment to be able to deliver the best care. They identify it's a great way of delivering the best care of treatment to their patients. It allows residents, I think, to really be able to evaluate their cases a lot more than ever before. I was very much brought up to basically taking photographs, literally visit by visit for a patient, or maybe alternate visits. It's a great way of reflecting back on where your patient has started from, how it's progressing, if it's progressing correctly or not correctly. I think with being able to monitor on a weekly basis, it really does enable us to evaluate at a much better and deeper, more meaningful perspective. So we get a lot more understanding of our mechanics, how teeth and treatment progresses, and enables us to evaluate what we carry out a lot more effectively. It allows our residents to be a lot more, I believe, a lot more familiar with their cases, seeing their cases on a week-by-week basis. This allows them to make much more smarter, optimized treatment decisions, and hopefully better use of their clinical time. As we're all aware, chair side is most important time. So if we can basically optimize our thinking, make smarter decisions, it enables us to be able to better use of our clinical time. I think the other thing that's very important for residents is that with using AI and dental monitoring, it does set them apart if they're familiar with utilizing it. As we all know, in business and in practice, uniqueness, the indoctrination of technology are important factors that patients nowadays look for. And I really do feel that it makes us more unique. It stands out more. It provides, good standing within their competitors when they go to work in practice. So it's providing them the tools for when they go into practice. I think also, as I've already alluded to, we always learn by looking at our cases, not the ones that go well, but the ones that don't go so well. So I think dental monitoring allows us, be it teaching environment, be it in business, in practice, it enables us to really reevaluate what we do, to critically think what we do, and to make decisions which are basically, if you like, practice-based, rather than evidence-based, but practice-based on a clinical level. And then finally, I think for residents, it's an invaluable communication tool. I've got a big background of multidisciplinary care for my patients as an orthodontist, and I think the monitoring and being able to share the monitoring files with our specialist colleagues and dentists is invaluable in our more interdisciplinary and multidisciplinary care. Then at the level of faculty, I think certainly the University of Pacific is well known and hugely regarded for its technology and its innovational aspects of its program. And it's what actually differentiates and sets us apart as an orthodontic program. So when we're seeing things that advance the care of our patients to optimize treatment and give them better treatment experience, clearly AI dental monitoring is a real must for our program and for faculty. I think it's also important to educate our faculty, not only our residents. And so I think it's a nice way of being able to indoctrinate and keep our faculty up to speed with the latest innovations. Certainly a lot of our adjunct faculty and full-time faculty that also work in practice, they're using artificial intelligence in many ways, and dental monitoring in particular. So it's a great way of keeping everybody up to date with leading innovations, and these things are constantly evolving. So it also allows them very much to keep up to speed with what is the current trends and the current teaching. Dental monitoring from an educational point of view also aligns with 3 of the CODA accreditation standards. So obviously, again, gives a great teaching experience because it enables access to comprehensive use of innovative technologies. It provides a platform for interdisciplinary and multidisciplinary treatments. And it also provides opportunities for research, which I'm sure we'll go into maybe a little bit later, but certainly provides opportunities for research in the field of orthodontics as well. I think certainly when I first came across dental monitoring, I thought it was more for sort of monitoring from afar. But what I've come to realize is how we can utilize it in a teaching program, how a powerful teaching tool it actually is, and a collaborative platform for learning and mentorship. And it really does expose all aspects of treatment and allows faculty to teach at all stages of progress of a patient's treatment. Where it used to be visit by visit, and which was relatively short and sharp, because we've got a constant file that we are basically accumulating with photography and the AI dental images, it enables us really to sort of critically think and evaluate all aspects of the treatment as we're going through. And we can reevaluate looking backwards as well. So I think it's important, terribly important. And it provides a platform for implementation, I should say, of an interdisciplinary approach to treatment. And obviously, we're looking at chair side efficiency and effectiveness and the scheduling of appointments. So again, from a faculty point of view, that's very important in terms of running a clinic.
Dr. Vaughan, as my role as the CEO of a marketing company and speaking to orthodontists and particularly residents on a lot of the Facebook groups that I'm part of, I hear a lot of residents that are they feel shortchanged, some of them, that in the programs that they're in right now that don't offer some of the technology that is now available. So I know that sentiment definitely is out there and can be a differentiator, but I'm also interested in the implementation because, I was an early adopter in terms of technology when I was in private practice. And I could tell you that in private practice, it's hard work to adapt a new workflow. I mean, you need to get the team on board, you need their buy-in. There are a lot of obstacles. Changing a bracket system, for example, was overwhelming, as well as new technologies like when Align first came into play, developing, learning, how to implement and incorporate that. But I'm interested in the challenges that might exist in an academic setting. Are they the same? Are they different? Tell me a little bit about, I'm sure you must have had challenges. Tell me what they were and how did you overcome them if you were able to?
Well, I think if I may just take a minute just to give you a little bit of an idea of my story. Clearly, you may recognize from my accent that I may not be US. So a large proportion of my career has been spent in London in private practice. And I came across dental monitoring really with talking to my orthodontic colleagues in private practice around about 2018, 2019. I considered myself, I like to see technology. I like to read and find out about it. And certainly would like to think that I'm an early-ish adopter. Certainly before you actually get to the crest of the typical curve that you see with indoctrination of technology, generally speaking. And I could see the benefit, but as you allude to, you really do come across a lot of challenges and a lot of pushback and a lot of resistance. And any early technology, it's very much a learning curve to the implementation. And you've got to think actively about how you're going to use it, how you're going to adapt it to your current practice philosophy, how you're going to monitor it in the practice setting, how you're going to engage it with patient care. Obviously, the financial integration of it as well, the additional costs that it poses. And as you said, getting the staff to buy in is by and large quite a large recognizable component part of that. I think the other thing is also considering what treatments are you actually going to monitor. Are you going to do a clear aligner therapy type treatments, fixed appliance therapies? And are you going to actually evaluate its effectiveness? It's okay implementing this, but how are you going to sort of monitor it? How are you going to evaluate it? Are you going to keep going? Are you going to change it, adjust it? do more of it or less of it. So, these are all the things that I came across. And I think I started back in 2019 in a very small pool of patients. We had a very nice practice in terms of a large proportion of our patients were either boarders from boarding school, so they had difficulty making appointments. And we had a lovely international flavor to the practice that I had a large proportion of patients that came from outside of the UK. So they would fly in for their treatment. So clearly, monitoring, be it with photography, was the way that I used to monitor my patients remotely, as well as see them obviously in person. So dental monitoring for me was really the next stage in my evolution and my development within my patient pool and the level of quality of care I wanted to provide for my patients. I think then COVID came along, and quite a large proportion of our patients weren't in dental monitoring. And I could see a direct difference between my patients that I could monitor with dental monitoring. They felt cared for, nurtured. We could have a very in-depth conversation at any time period of scheduling we wanted to, versus patients at the time, at certain times anyway, certainly we couldn't even see our patients. So it was very much two spoons in the mouth and take some photographs and try to get some reasonable quality photographs. So I think we might all recall the COVID issues and challenges we faced. So I think with that background, obviously, I clearly understood the value and the implication and the indications that dental monitoring could provide in a practice setting. And really, I wanted to bring that to an academic setting. So clearly, different challenges. Quite a large amount of them are quite similar, as I've already mentioned. But obviously, a few more specifics in an academic setting. Really, what value does dental monitoring bring really to the patients that we treat in an academic institution, to the residents and to the faculty at large? How do we integrate this within the teaching curriculum? How do we allot time for our residents, times for our faculty, times for adjunct faculty who come in on certain days of the week, as well as people that we're going to expect to implement things. So very important. The actual contracting process is quite interesting, as we all know in an academic institution. It was very much along the lines, our own personal process was that we wanted it as a department. We realized the value of the modality. It was very much speaking to our associate dean of clinical practice first to ensure that they understood it and they could also see the value and they were keen to promote it. We then had to go through contracting, the legality, our business center. So there were many hurdles to get through, as one does through an academic institution. Compared to practice, you just choose to do it or you don't do it in many respects, having done your homework. So it's quite time consuming. I think in terms of actual challenges, though, in the academic setting for the residents, which is the most important thing from a faculty perspective, it's very much to try and spend the time with the residents so that they appreciate and understand how it operates, how to use it, the different ways you can use it, how they just explain these to the patient, and how they basically get the buy-in with the patient, how they basically set up their dashboard, to basically check their dashboard on a regular basis and to basically keep an eye on notifications, to make sure that they answer their notifications in a prompt, timely manner, which, as we know, residents are very busy people, and it's difficult. It's yet another thing that they've got to learn to do and to do consistently and do well. So that produces its own challenges. And for the faculty to spend time in monitoring these things, giving help where help is needed. But I would say dental monitoring from an academic viewpoint have been amazingly supportive in that, and really have tailored training and support whenever it's been needed. So I think it's very useful. I think also on a personal level, I'm very much into patient management. It's an area I love, and in communication in particular. And one of the first things when I met the dental monitoring team was to set up a WhatsApp group, simply on the basis that if we came across any problems or anything like that, we could just communicate immediately and have solutions and answers as soon as we possibly could. And we found that very, very helpful in starting and setting up the onboarding process for the whole of the faculty, residents, etc. And it's been an interesting, challenging, but we've overcome quite easily all the obstacles that we feel were posed to us in that academic setting.
Yeah, I mean, on the surface, it sounds overwhelming, but it sounds like you've just dealt with it as the issues came about, and had some support from dental monitoring to ease through it. I'm curious. I know that I mentioned on the Facebook groups, I get messages from residents all the time about technology. And, as you know, our residents are digital natives. So I'm assuming the answer, I think I know the answer to this question, but I'm curious as to what your residents' reaction was when you began adopting dental monitoring into the graduate clinic.
Yeah, yeah. Well, I think I identify we take 8 residents per year, and they're all super digitally knowledgeable. So I think they, I would to sum up, I think they were really excited about the possibility of adapting the DM program into the residency. We're known for our innovation and our technology, so that attracts that sort of like-minded resident, I guess. So, to put it in a nutshell, they were terribly excited. The majority had heard about dental monitoring, but I think there was some reticence about, how does it work? Is it going to have implications for the length of time they need to spend with patients? Is it a lot to learn? Is it easy to incorporate? Um, and I think, I would say, to sum up, they really did think that it was for remote monitoring in terms of, people that lived a distance. And it just
Mhm.
enabled us to be able to monitor their treatment from a distance because they couldn't make appointments. I don't really think that they realized the educational value, the clinical value, and obviously how we can utilize it going forwards as a patient, as a practice management tool for efficiencies, both in treatment as well as streamlining appointment and scheduling and these sort of things. So I think they understood dental monitoring at probably quite a superficial level. The more they found out about it, I think the more super keen they became, keen about it. I think the other thing was, like I said before, they also realized that a large proportion of orthodontic residency programs don't really offer it as well. So again, a differentiator, it makes them feel special. It's something special that they can offer patients going into practice. So forewarned is forearmed, and it gives them an edge and a uniqueness. And again, that's something, from a program perspective, we're very keen to give our residents when they go out into the big bad world of business.
Yeah, yeah. And I can tell you, from a competitive standpoint, I have as a marketer, I have my pulse on what's going on in the business side of orthodontics, and any competitive advantage that you could provide certainly is an advantage for them differentiating themselves from other graduates in terms of accepting different positions. Um, I'm going to switch a little bit because, as you're speaking, I'm thinking about when I was in private practice, sometimes even teaching a patient to wear rubber bands was daunting for them and frustrating, and cooperation, was in it, particularly with adults, in terms of just putting on class two elastics. Maybe it was the dexterity. I'm not sure what the issues were, but I remember those days. So I'm curious as to the reaction of the patients in the clinic when you're asking them now to scan at home. How do they react to that?
Again, I would say really quite positively. We had very little resistance, very little negativity. I think, the children, the teenagers, they were a bit, I suppose, a bit surprised by it. They hadn't really come across such technology. As soon as you introduce it, I think they can see the advantages of it. Like all indoctrination of new technologies, there's an element of sort of, I don't really know, you worry about, can I do it? It looks a bit complicated. But I think the most important point really to bring out is that for it to work and be implemented, I'm a firm believer that you need to understand why it's being implemented. What are the advantages of it? Really spend time on explaining how to do it and do it correctly. And I think that makes a big difference in getting the continuity of use going forwards. It's a bit like your class 2 elastics, as you sort of mentioned. You can give class 2 elastics and send the patient away with very little explanation apart from where you run it from and to, maybe between teeth on a brace. But I think it's very important for them to understand, what is it doing? How is it doing it? Why do I have to do it as I need to do it? And so I think the explanation to the patient, just spending that extra 5 or 10 minutes of explanation, I think really does reap rewards and benefits going forwards, because it's something that if they're explained really well and thoroughly to begin with, it really then will stand the test of time going through their patient treatment. There's nothing worse than giving something, they come back, they haven't been bothered, they don't understand how to use it. If you don't understand something, you don't use it, do you? So I think it's really important. So, children, teenagers, broadly, very positive, really quick. That's the diddle age. That's what they're used to. I think with the adults, we treat quite a large proportion of adults of various different ages and different socioeconomic backgrounds. I think there's always that sort of concern about new technology. Have they got phones? How do I get the app downloaded? It's those things. So I think time spent explaining, giving them written information as well as verbal information about it, and trying to provide as much support as possible to get them involved in it, I think pays is very, very helpful. I think going forward, since we've introduced it, so our timelines have been along the lines of onboarding. We started in January this year. So we're coming up to our 1-year anniversary. But certainly out of all the cases we've started, the vast majority have been consistently and kept going, very, very nicely with us. They've been happy to do so. And I think they felt very reassured by having dental monitoring incorporated within their treatment, because they love the idea of having feedback, whether they're doing good, bad, or indifferent. So I think all in all, the reaction's been very, very positive.
So Mark, I mean, I have so many questions regarding, how the leadership, came to this decision, but I'm keeping one eye on the clock. So I want to circle back because I know we have a lot of faculty here from different institutions that have a lot of questions regarding how did you move this thing through? And in particular, I know when I talk to some of my colleagues, faculty at other programs, one of the biggest issues that they have is dealing with the IT aspect of it, the HIPAA compliance aspect of it. The universities have, as a vested interest in keeping the data safe and coming to them with, this concept of dental monitoring, opens up a lot of questions. So I'm curious, bringing this new technology into your program, could you give us a little insight in terms of your experience, in terms of what did it take to gain the university, the IT, the legal department, all the different areas that you need to get approval for, and what did the process look like during this stage?
So obviously, a very good question. I'd have to say that overall, we found it a very, very simple, straightforward process, dare I say. We had a lot of support from dental monitoring in terms of what the expectations were, how we went about things. They were terribly supportive and understanding that they're dealing with an academic institution, and things take a time. It's not like in practice you can implement it literally the next day. You know, and as I sort of alluded to before, you know, we identified the technology. We thought it was amazing. Quite a few number of faculty had already used it. Obviously, I had a big push in that as well because I could see the value having used it myself. And really, it was a matter of just, you know, talking to the various people within the academic institution. And as I've mentioned before, it was really discussing it with our associate dean for clinical practice, first of all, to get them on board, to realize, you know, what value it could provide. I think it's always showing what value out of something that you can get. You know, we're hoping to be able to look going forwards with dental monitoring, um, the 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 statistical side and the data or the data side of things to really see how efficient we are with our patients. A large proportion of our patients are challenging. They take a long time to treat. If we can try and speed that up, if we can use our chairs more effectively, more efficiently, we can be, you know, a little bit quicker with our appointment times for residents. As we all know, you know, residents, we take as a resident, myself, you know, we took a lot longer to do a bond up, 2 hours, 1 hour for a bond up. In practice, it's a fraction of that time. So I think if you can show the value that bringing something like this can actually hold for the school, I think that is very, very important. And so you're getting the associate dean for clinical practice was very important. And then really it's working through the business center, the contracts department, the legality of it. We're very tight on legality, being HIPAA compliant and make, you know, patient identifiers and all that side of things. But having said that, we found the process particularly straightforward. You know, to give you an idea, it took us about 6 to 8 months from start to finish before the onboarding process with DM. And we started really in the sort of like the March 2023. We finished in October 2023. The hardest bit really was the legality of the contractual side of things.
Mm.
Just simply, it takes time, and our contracts were going back and forth, back and forth, back and forth with the particular wording in things. Having said that, I would say that dental monitoring really did help us there. And they really were, number one, patient, but they also helped us with the wording of our legality contracts as well. So we managed to negotiate it, I would say, you know, a lot easier than I was expecting to.
Yeah, I would imagine that, you know, if I were dental monitoring, I would be putting a lot of resources in this area because this would be a hurdle that, you know, each of us have to deal with. And I know, you know, from talking to some of the department chairs, you know, they get buy-in and from their faculty, which isn't always that easy. And everybody's on board, and then it kind of sits with IT and nothing happens from there. So I know that Vicky in particular is very involved in this, and she kind of holds everybody's hand and moves the process through. So so once you sign on, once you agree, once you get overcome all of those hurdles that I
Yeah.
mentioned, and it sounds like it really didn't take all that much time to do, but once you do that and sign the contract, then what happens? Like what does the onboarding process look like? What support do you get there, or are you kind of just on your own to now you know figure out how to do it?
Well, I think really, you know, from a faculty point of view, you know that there's got to be a lot of momentum. There's got to be a lot of inertia. It's got to be a lot of push from faculty. Number one, bring it in, but there's got to be consistency and there's got to be backup in that aspect. What I'd also say is dental monitoring, and I've got no financial interest, I hasten to add as well. But you know, they also identify, you know, what are the failures of bringing something like this into a faculty orthodontic program. And so they really are extremely supportive. The way we worked, it was very much that we identified that contracting would probably take about a year. And as I've alluded to, it was a little bit sooner. We finished in the October 2023. And then it was a matter of how do we onboard this? So our residency starts really in the final quarter of the year. So and that's when they're starting to learn their wire bending, and they're starting to learn bond up techniques and bracket positioning. So we thought that we would leave them to do that for the first quarter up till the Christmas time. And then what we would do is we'd start the onboarding in the new year. So that was in January 2024. So the way we did it was that dental monitoring set up dashboards for the faculty, and they gave all our orthodontic residents asynchronous learning modules in order to just understand the process, what the component parts are, how you put them together, how you scan, problems that you can get with scanning, what a dashboard looks like, and just the various basics of the dental monitoring dashboard, how you can modify it, and how you schedule or suggested protocols in scheduling. So they were so that the residents were pre-warned, if you like. And they did that in their own time. We gave them about 10 days in order to be able to sort of take on that information in the January. And then Vicky and her team, a big shout out to Vicky, Kayla, and Paul for all their help and ongoing support and help. They then spent a whole day with us going through all aspects from the basics of the actual parts, if you like, how you put them together, how you scan, doing it on one another, and just really a few lectures in a very sort of informal manner within the residency. And then in the afternoon, then we actually chose a patient each resident had a patient, and they introduced it to the patient. And they were sort of coached a little bit in the morning on how you present it to the patient, what things to say, how to say them. And then the residents had a practice session, if you like, with their patients on the clinic in the afternoon of the same day. So we had a complete day. It was a whole lot of fun. We had some great times and great memories from that. And that really started off, I think, in the vein that we wanted to continue and build on the momentum of things. Then, like all these things, it starts off well, but it's what happens next. And so I was very keen to make sure that we kept our connections. And DM they identify this as well. And so then there was basically, we were then reviewed about 6 weeks after that, 3 months after that. And really, it's tailor making the support that we need as we're going along, and as faculty and residents feel that they need that support. So it was, I would say, it was a great introduction. I think it was done very well. I don't really know how it could have been better done, if you like, but it certainly made the onboarding process very simple and straightforward.
So, what about, your academic curriculum? I mean, are there ways of utilizing dental monitoring in that aspect as well?
Well, I think at the moment what we've done is we're sort of phasing it. In my mind, we're phasing it at the moment in the curriculum, and really it's getting them to be au fait with it, getting it as a component part of normality within what we do with our patients and the care of our patients, and really scheduling and just getting them to be conversant with the use of. And enabling them to help with scheduling and delivering the high quality of care that we all, wish to attain. I think the next phase now going forwards, I'm very keen in the curriculum to have time set aside whereby we actually look at cases that are dentally monitored, so that we can really put a curriculum together of how we're going to use the information and the data in a more um, in a more smart decision making type of way. And from that, it would be nice to have cases that have been ongoingly treated or been treated to evaluate what the take home messages are, what areas we find are particularly of value that we haven't currently got in the curriculum, and obviously introduce that into the curriculum as component parts. I'm also keen to use it as an assessment tool for ongoing care, quality of care, to see, number one, where are we at the moment? Can we improve the quality of care, the scheduling, chairside time, decision making? And to try and evaluate that to see whether it has, which I believe it has, a lot more fruit to bear in terms of what we can learn and how we can assess our treatments of our patients. So it's very much an evolution at the moment and an ongoing process, and that's where we currently are with it at the moment.
Yeah, you know what? I love that because I've always been a proponent of taking a set of, I used to call them slides, I guess digital photos, um, at each visit. So, so from a teaching standpoint, we could go through, well, let's see what that wire did, or what that aligner did over the past 6 weeks or so. But here, I mean, you could really get so much data where you could see what's happening on a weekly basis and where things might go not as expected and why. So as a teaching tool, I would think that, if I were a resident, I'd have a tremendous opportunity to look at so many different cases and really pinpoint what went right and what went wrong. And the value of that, I think, is phenomenal. So, I'm keeping one eye on the clock because I want to have some Q&A. But just in terms of wrapping up, it's only been really a year that you've been involved here. I'm curious as to what your goals are. What do you see moving forward? How do you see this particular technology being of use for you moving into the future?
Well, certainly my aim goal is to try and improve and enhance the standard of care of the University of Pacific patients through the ethical use of artificial intelligence technology, so that we've got what we call patient-centric treatment for our orthodontic residency. I'm trying very hard for residents to have a much more meaningful understanding of tooth movement and treatment mechanics. And as you've mentioned, we always used to be able to evaluate things even if we took photographs on an appointment by appointment basis. Now we've got the ability to be able to do it by a week on whatever our scheduling is, obviously. But if it's like a week on basis, the amount of information we can glean is massively more than ever before. And I think it enables us to see, how things normal. We have a much more in-depth understanding of how things actually work on a day-to-day basis, if you like, rather than a couple of months by months basis. So I think that will be very insightful. It'll enable us to really see what works and what doesn't work more clearly. But also, we've all got an inbuilt time clock, I think, in terms of what we expect our patients to come back when we see them for their next appointment, to see, is it like that or isn't it like that? Where I think to be able to monitor it and see it as it unfolds, I think takes a lot of the guesswork out. And certainly, what we'll be able to evaluate what works better, quicker, and what the disadvantages of things are much quicker. And obviously that will improve the speed and quality of treatment and the quality of care. So I think it's a very, very important resource. And, we're trying to provide our graduate program with as many resources and armamentarium for going out into the business world. So I think it's really priming them to be able to be in a really good position for that situation. I think also, indoctrinating artificial intelligence, dental monitoring, is enabling our university program as well to maintain its high profile. I think that's
Mm.
another goal. And I think for the future, what I'm really looking forward to is we're currently in phase one as dental monitoring for, whereas phase two is very much more into the professional side of things, where we can really get a lot more data, as you've mentioned, to really be able to see what are we doing, what are the residents, how are they treating the patients, what's the quality of care, and we can really try to home in on how we can improve the program, how residents can improve their care for their patients, and how we can optimize everybody's care in the department going forwards, and therefore be more effective and more efficient. So I think it's got a lot of important aspects that I feel that we can bring to our curriculum. Finally, it would be nice, obviously, to be able to evaluate. We need a process in place to evaluate dental monitoring in terms of its own value to our residency. And we've also got some ideas about incorporating it into research as well, with the data that we'll be able to get from the phase 2 in our next year of dental monitoring, I'm really looking forward to seeing what we can actually utilize for in a research sort of situation.
Well, Dr. Mark Vaughan, you're a gentleman. Thank you so much for sharing your experiences with us today. I think after this, I'm going to get myself some fish and chips and some warm beer.
Sounds great. You must get some mushy peas as well.
Okay, definitely on the agenda. Before I let you go, Dr. Vaughan, if any of our colleagues want to get in touch with you with any specific questions at all, what's the best way to reach you?
So I guess, email, if you will,
Sure.
and that's mvaughan, so that's MVAUGHAN at pacific.edu. So that's mvaughan at pacific.edu. And I really don't mind giving out my phone, my cell number as well, if attendees would like. And that's 650-398-9586. And I'm very happy to text or to take a call. It's not a problem.
Thank you, Mark. We really appreciate it. Lon, I'll turn it over to you for Q&A.
Okay, great. Great webinar. There are a bunch of questions, and some of them you've touched on, but there is one question I wanted to get to. You were talking about advancing the dental monitoring program at U of P, but are there any things that you want to take a deeper dive into with dental monitoring at with your program?
We haven't got enough time, I don't think, to list how many I'd like to do. But I think one key thing, and I've already mentioned this, is that, as an orthodontist, we see our patients, every 4 weeks, 6 weeks, 8 weeks, whatever our time is. And it's only in that's what we're used to as being our normal schedule of evaluation of what we carry out on our patients and the effect of what our intervention is at each visit. I think if we can basically be able to evaluate our patients on a week by week basis, I think we'll learn an awful lot more about what we're doing. That aside, with what we can communicate with our patients like never before in a digital environment, in an environment that they nowadays, they live on a second by second basis. So I think to integrate with it, that I think is terribly important. The game is always to try and understand mechanics at a deeper level as much as we possibly can. What works, what doesn't work. We can only evaluate that if we're constantly looking at things. As a teaching tool, as we've already said, taking photographs visit by visit and re-evaluating what we've achieved is the way we learn. We can all show good cases. It's basically the bad cases. What went wrong? Why did it go wrong? How can we evaluate that? Well, if we've got documentation on a weekly basis of that, that's so much more than visit by visit sort of documentation, if you like. I think the research component to it, and as a business management tool, I think will possibly be very effective in terms that we really will get data that we've never had before, and that lends itself to scheduling of patients in terms of how we interact with patients. In terms of how our residents are in an educational setting, how they are treating their patients, how they could do better, how they, how good or bad they're actually progressing in their interactions with patients. I think it's lovely. I've always been a keen proactive person regarding patients being able to contact their facilitator for treatment because they feel assured. And that gives them an air of confidence. And again, it gives you uniqueness, and that's what it's all about as well. I'm terribly interested in what research opportunities that we're going to basically have with that data. I know DM are very, very keen to get involved with research with us, and obviously that has its own implications for an academic institution and setting. So that's very, very useful. And also I have got a particular, since I've come to the US, a particular interest in sleep medicine and oral appliance therapy, but one of the treatment modalities that we offer on our sleep clinic here at UOP. and I'd like to be able to use dental monitoring with our sleep appliances. Basically monitoring occlusion and unwanted tooth movement, this sort of thing. And obviously a lot of research can be done on that basis as well. So there's many applications that I see going forwards, being able to use dental monitoring going forwards in the future.
Okay, great. Well, you answered two questions in one because someone had an additional question about research with dental monitoring in your institution. So that's great. So that was a twofer. Um, Here's another question. It's kind of two parts. Like, at what point did the University of Pacific leadership, uh, you know, decide to go with dental monitoring or this kind of innovation? But also, was there any resistance from either the faculty or the residents or administration or anyone within your university um, when adopting dental monitoring or any kind of similar technology, specifically regarding the AI aspects? We all know AI, you know, has some great, implications, and we've seen the negative implications. But is that something that was considered when you adopted this as well?
Yeah, certainly, of course it was. I think really, we're very lucky as a program, as a department, that we're very forward thinking in technology and everything like that. And if something new comes out, we're looking at it, we're looking, researching it, and we get it into the department. So I think with that sort of philosophy, and that's a natural philosophy that the full-time faculty have within the department, but obviously its implication for orthodontic program residency, that's even more important. We want to give our residents the best education. We want to give them the best armamentarium in which they will be going out to basically treat patients. So, if that's the philosophy of the department, something new comes out, they're very keen to certainly consider it. And it's really trying to hold us back, really, in terms of being able to take it on. So, in terms of the leadership within department, we were all very pro it, to be honest with you. I think it was very helpful that I'd already used dental monitoring, and I'd had some very good successes with it with my patient population, as well as the boost of going through COVID gave us in terms of identifying its value. So I think in that respect, that was terribly helpful. In terms of the school in a bigger picture, the school is known for its innovation and technology. I was only speaking to the dean this morning of the school, and we were talking about wearables for, OSA and diagnosis. And it's connecting with industry and really trying to see where pushing the boundaries of what we can do and everything. So, the school has got that philosophy. Everybody's got that sort of philosophy. So there's no real resistance. It's really what's the value and can we get it into the school? What are the hurdles? And can we make it happen? So I would say that we're very fortunate with that philosophy, that it was quite easy to bring it in. In terms of utilizing it in the department, clearly there are time implications for faculty, support staff, which clearly people have some concern about. But I think equally, when you've got that sort of philosophy running in the department, people want to make things happen if they can see that it's coming from the leadership, and they can see that it is actually utilizing technology for the better of patients and for the residents' education. So really, it was very streamlined, and the onboarding process with the dental monitoring team just made it work really well and seamlessly. So we were very lucky that we had very few problems of onboarding and taking it on in the department.
That's great. Okay. Um, this is great. We had a bunch of questions. I have a couple more, but I will send them over to you, Dr. Vaughan, and we can
Thank you.
address them somehow. We're just about out of time. Really appreciate you coming on and performing this webinar with us. It was very much needed for orthodontic residency programs and the attendees.
Okay, thank you very much. It was a pleasure. Thank you, number one, for being invited. Secondly, obviously, this is just to reinforce, this is the first year of our dental monitoring onboarding, if you like. And it's, we can see it from a clinical viewpoint, we can see it from a teaching residency, the potential it has going forwards. but we're super excited to find out about the DM's stats and data and what that'll bring to the residency, because it really is going to enable us to evaluate residents' performance, clinical performance, as well as the program's performance in teaching at that. So we're super excited at part 2, if I like to say it, in 2025. So thank you very much for the invitation.
Well, thank you, Dr. Vaughan. Thank you, Lon. Thank you, everybody, for listening. We really appreciate it, and have a great day.